I'm not really sure that I need to say anything. They've said it all. But I do want to talk about how we got to this point, because I think it's very important to understand. You know that we've had great support from the state senator, from our... Now I'm in the dark. It's probably easier to talk that way. But we really have to thank our leadership at the city, at the county, and the state, because they've really kept this alive. And I'm really not here to tell you that the interest of our hospital that I work at was started at the idea we need to save San Leandro. The way we have come to this point is we've looked at the numbers. We've looked at what the need is in the Eden Township District. And you've heard it already, over 25,000 emergency room visits a year. At St. Rose, we have just slightly under 40,000. Wow. We added 30 beds. We're already operated capacity. Eden Hospital currently operates at capacity. We could all tell stories about how difficult it is to access services. From those numbers, we looked at what are the responsibilities we have as a community hospital, as a local board. And for some of you, we do have 16 members of this community and Hayward that sit on our board, including Sheriff Emeritus Plummer, so you know we get a lot of direction from him on focusing on what are the needs of the people that live in this district. So you start looking at the numbers and you begin to realize very quickly that losing San Leandro as a resource would be a major detriment to the total health status of all of the people that live in this district. We do not have enough emergency room capacity. California ranks 51 out of 51 in the United States for ER capacity. And we deal with things called the Hayward Fault. So we have to plan for that. But the numbers also translate into a responsibility to do something that is fiscally responsible. So what we have done, and the staff that I work with and other financial analysts, we have looked at the utilization numbers that come out of San Leandro Hospital and the utilization numbers that come out of St. Rose Hospital. We've looked at our labor cost. We've looked at our supply cost. We have looked at the revenue associated with that. And we believe strongly that we can operate a combined San Leandro Hospital, St. Rose Hospital, under leadership of the Eden Township District, and do that in a financially responsible way. We also know there is opportunities that are out there that we can also take advantage of. This includes an opportunity to increase the federal share of dollars that could flow to this community because of the service we provide to people on the state's Medi-Cal program. Currently, there's an opportunity there. The precise figure of that in our calculation is somewhere between $7 million and $13 million on an annual basis. That's through an intergovernmental transfer process, which is probably more complicated than anyone would want to talk about tonight. But it shows another opportunity of the district as a public entity owning San Leandro, owning St. Rose, and operating those facilities in the benefit of the district, that we can achieve even greater financial support for the district, the hospitals, and the community. Now, in order to do that, it's not a simple process. We need to have the support of the medical staffs at both St. Rose and San Leandro. We need to have their commitment to look at what the healthcare needs are of the people that live in these communities and design programs that meet the needs of the communities, not programs that are designed to meet the need of the hospital, but focusing on what our residents need in this district. So there are unmet needs that some people have talked about. We have a great need to work with Alameda County Medical Center on replacing beds, rehab beds, those at Fairmont and those when Laurel Grove closed. It is not appropriate for residents of the district to have to travel, in many cases, 50 miles or more to get rehab services. We need to address the need for inpatient psychiatric facility. The new hospital in Sutter, Castro Valley will not have psychiatric capabilities. We also understand that there are the growing needs for outpatient services that need to be done in partnership with the medical staff, because we are going to be more accountable for the cost of care. So what we have presented and want your support in is not the Michael Mahoney plan, it's not the St. Rose plan, it's not the San Leandro plan, it's the Eden District and its responsibility to provide services to the people that live in the township. I believe we can have a path to make this financially stable, opportunity to meet growing needs and present unmet needs, but it is not going to be easy, and it will take all of us working together. Forums like this will be essential for us to understand that the hospital is moving in relationship to the needs of the community, not the other way around. Thank you very much.